Greetings, I'm Dr. Thomas Satterwhite, and I wanted to take this opportunity to speak with you about body contouring, and more specifically, the broader category would be referred to as body gender-affirming surgery. For the purposes of this video, I'll focus on body masculinization. And once again, the goal of body contouring and body gender-affirming surgery is about creating a body that matches your particular gender identity, and more specifically, your gender expression, okay? So there's never one procedure or set of procedures that are going to be done, that are going to be applied to everyone. It's about me meeting your particular goals and expectations and finding the surgical procedures and techniques that match that. So it's going to be a one-on-one discussion. It's going to be about finding what your goals and wishes are, and then me finding those techniques that can meet that. But once again, if I use the broader term of body masculinization, when I say that, it's about, once again, creating a body that matches current cultural standards of what a masculine body would be. And once again, I'm using this as a generalization for the sake of this video, but once again, when we do have that one-on-one discussion, it's going to be about body gender affirming surgery. So creating a body that matches you as the individual, just to be clear on that. Okay, so with that being said, my number one priority is always going to be about safety. Okay, always safety first and foremost. And I'll say that multiple times here in the video, and also say that, when we have the opportunity to chat during the consultation. And so as we go through the process of having body contouring or body masculinization, what's important to keep in mind is that I want you to be very clear about that process, about what to expect before the operation, during the operation, and then what to expect after the operation in terms of the recovery. So with that being said, what are the things that we need to do before the operation, right? So at the time of the consultation, I will be focusing, as I said, on first and foremost your safety. So I'm going to spend some time going through your intake form, going through your medical history, because I want to find things that could potentially I want to find things and ensure that they're not going to add any undue risk for you. Okay, so I'm essentially looking for anything in your medical history that could potentially lead to wound healing problems, that could potentially lead to undue scarring, that could potentially have adverse interactions with anesthesia, anything that can lead to prolonged bleeding. Okay, those are going to be my priorities. So when I do go through your medical history, I'll look for history of diabetes, for example. If you do have diabetes, I want to make sure that your sugars are under control before moving forward. History of HIV. If you have a history of HIV, we want to make sure that your CD4 count, viral load is, CD4 count's normal, viral load is, undetectable. If you've had a history of lung issues, history of heart problems, history of any neurological disorders, all of those will go through completely to make sure that those are optimized before moving forward. So I do want to make sure that you're as open and honest with me and my team as possible, because we want to identify any of these issues before moving forward. It's rather rare for me to say no to a patient who wants to move forward with an operation. But what's important is that I know what your medical issues are, so that we can appropriately prepare and optimize and work with your other doctors to ensure that those are kept under control and certainly optimized before moving forward. The other things that I'll look for are surgical history, right? So we'll see if you've had prior abdominal operations in particular, because that could affect, what we can do for the operation for body contouring. I'll, ask you about, basically I want a list of all of the, prior operations that you've had before, because the best indicator of how you do with the future operation is how you've done with prior operations in the past. So that's going to be important. We'll look through medications, look for anything that could potentially lead to bleeding. They could have adverse effects with the anesthesia. So be very complete with all of your medications, even over-the-counter herbal medications. And then we'll talk about any allergies that you might have to medications. Then if you have a smoking history, if you use any tobacco products, nicotine products, any vaping, you do want to hold off typically for about a month before and a month after the operation. Super important. If you do use any marijuana, THC, CBD, if it's an edible, can usually use that around the time of the operation, but if it's any type of smoking of any sort, you do want to avoid for a month before and a month after, because that will definitely lead to wound healing issues. Then I'll also talk with you about, your social support, where you live, if you're seeing a current therapist as well. What's really important is to make sure that you do have a good social support system at the time of the operation, because it can be a stressful event. It can have effects on you mentally, so you do want to make sure that you do have people around you that you can turn to if issues do happen. Vast majority of patients do well, but once again, with any stressful event in life, sometimes, particularly if you're predisposed to depression or anxiety, stressful events can bring on those negative feelings. So having that support around you is going to be helpful. And you can certainly reach out to me in my office. We're always going to be available, but really having that solid support. And I'll also talk with you about, whether or not you're working in school, because that has implications in terms of your post-operative recovery, because you really do want to give yourself several weeks of recovery post-operatively as well. So then once we've had that that initial review of your medical history, so once again, looking at your medical, surgical history, psychological and social history, then we'll talk about your particular goals and expectations. What is it that brings on dysphoria for you with your body, is going to be important. I want you to be able to verbalize that. What can sometimes be helpful for some patients is providing pictures of what you view as the ideal body type in terms of, what you would like to look like in terms of having resolution of your own, body gender dysphoria. And I think those pictures can be helpful because they do provide a template in terms of what can be realistic or what isn't realistic, okay? I think what's also going to be important, obviously, is me seeing your body. So either via pictures, if we're having a remote consultation, or certainly in person. So I want to assess the quality of your skin, where you have fat that's located, just having a general sense of what your body looks like, because that gives me a determination of what we can particularly achieve at the time of the operation. So for focusing specifically on body masculinization, what this involves is creating more or less a body that's more rectangular. So if you think about it on a general level, a more masculine body tends to have a more, if you're following the lines from the side of the body, so from the chest to the abdomen down to the waist, tends to be relatively straight. So that, once again, culturally is deemed, masculine. A more feminine body tends to be more of an hourglass figure, right? So it's going to be wider at top, cinched waist, and then wider at the bottom. So many of our patients who may identify, as transmasculine or even non-binary, or any other, actually any type of, gender identity, who wish to have a masculine body, then the goal is creating more of a straighter, more rectangular body. So for many of these patients, it's about removing fat from the butt and hips, and maybe even from the abdomen and the flanks as well, to create more of that streamlined rectangular body. But once again, I would talk with you, do the physical exam, see what your goals and expectations are, to see what procedure or set of procedures would meet those particular goals. If we do body masculinization, it can oftentimes be done in conjunction with other procedures such as top surgery. So I have some patients who want to have a mastectomy, and then at the same time we can also do body contouring or body masculinization at the same time. And there are some patients who may want to move forward with an abdominoplasty. So if they have excess skin or fat in the abdomen that they want to remove, then we can take that out as part of a tummy tuck or abdominoplasty. Patients may have extra skin or fat under the arms that they want removed as well. That can be done. There's a whole host of procedures that can be done in order to create the body that you may want. Other things to think about, so patients may want the inner part of their thighs addressed, or medial, what's referred to as a medial thigh lift, or having liposuction in the inner part of the thighs. And there's some patients, as part of the masculinization process, may want to have pectoral implants. So there may be patients who feel that despite the use of hormones, if they're using hormones, masculinizing hormones, not everyone is, despite the fact of that they've been exercising may still have a chest that they don't feel entirely comfortable with. So one option is, moving forward with putting in pectoral implants, and that can be a possibility. I think what's important as we move forward with body, contouring, is that you want to make sure that you maintain a stable weight, because you don't want to have a lot of fluctuations in your weight, because that can affect your results and the quality of your skin. So once we've, for you, decided on a particular operation or set of operations, then I'll let my administrative team know, and they'll reach out to you shortly after that. Usually, once they've reached out to you, and this will be shortly after that consultation, they'll talk with you about working with insurance. They'll also talk with you about setting up a particular date for the operation. We want to make that process easy for you. So we have a huge team, administrative team, that's really going to work with you hand in hand to navigate this process for you, working with trying to get insurance coverage. The vast majority of my patients are covered by insurance, so we really want to make it easy for you. And then, of course, setting up a date that's going to be appropriate and easy for you. And we want to make sure that, when you do set up a date, that you have adequate time set up for recovery, that you do set up several weeks post-operatively for recovery, that you have someone that's going to be traveling with you during this time. This is going to be very important as part of your post-operative recovery. As I tell all of my patients, the operation in and of itself is oftentimes the easy part. It's that post-operative recovery that can take time, that really takes a lot of energy. So you always want to keep that in mind. So once again, my administrative team will contact you. They'll talk with you about the nitty-gritty logistical things. And then afterwards, one of my nurses will contact with you as we get closer to the date of the operation, usually a couple weeks beforehand, to review your medications, your medical history, to make sure there are no changes in those areas. And then we'll have a preoperative visit, which is usually, a couple days, a day to a couple days before the operation. At that point, we'll once again talk about your goals, your expectations. We'll talk about the surgical plan and make sure that we've optimized that. If there are any changes, certainly let my team know. That, once again, it's always an ongoing discussion, that if there are changes from the time of the consultation to the time of the operation, just let my office and my team know, and we can certainly help you in that process to ensure that we're meeting your goals and expectations. At that preoperative visit, we also do provide you your medications as well. So prescriptions for medications, we confirm your lodging, where you're going to be staying, who you're going to be staying with, and once again, ensuring that that we're set up appropriately and safely, and then also confirming where your operation will be. There are several places where I operate here in San Francisco, and we want to ensure that you do show up at the right place, and the right team will be taking care of you. On the day of the operation, you typically show up about an hour and a half or so before the operation starts. You'll meet the staff, the nurses, everyone is going to be taking care of you. You'll see me right beforehand, and then I'll do my markings, on the body in terms of the areas that are going to be involved. So once again, the vast majority of patients who do want to move forward with masculine gender-affirming surgery or body masculinization typically want to have, liposuction from the hips and from the abdomen, and for some patients even from the buttocks. And so once again, I talk with you about that and determine those areas. So if we're doing, for liposuction in general, typically is going to be done under general anesthesia. You're going to be asleep. Procedure usually is about an hour and a half, maybe 2 hours. And as I said, can be in conjunction with top surgery if we're going to be doing that at the same time. So in general, if we're doing top surgery and body masculinization at the same time, can oftentimes be maybe a 4 to 5 hour, operation. So with liposuction of the butt and hips, I use small little incision sites, usually, within the underwear line, so it's not going to be visible. So anywhere from, 4 to 6 little small incisions, a couple millimeters in size. And through there, I place the cannula, which is a long metal rod that has a vacuum attached to it, which suctions out the fat from those areas that are of concern. And once again, for most patients who want body masculinization, that's going to be from the hips and the buttock region to create more of that streamlined appearance. So after I've done the liposuction, then I close all of those areas with absorbable stitches, so nothing to have to take out later. And then you will have some type of compressive dressing around those areas to help with swelling and bruising. If we do an abdominoplasty, there's some patients who want to move forward with a tummy tuck or abdominoplasty, then this involves a longer incision right along the lower aspect of the underwear line, so that'll be hidden. And that usually extends from one side of the abdomen to the other side of the abdomen, once again, use absorbable stitches and usually some type of tape or glue over that area to help reinforce it afterwards. And then you'll have an abdominal binder. So a tummy tuck can be a bit more of an extensive operation, a longer recovery, but can be, an important operation for someone who might have a lot of extra skin in that area, or an overhanging pannus, which can sometimes, or overhanging skin and fat from the abdomen, which can lead to hygiene issues, and certainly can lead to a lot of gender dysphoria and body dysphoria in general. Another aspect of body masculinization that some patients like to move forward with, as I was mentioning before, is pectoral implant. So placing silicone type implants under the muscle to create more of a convexity and roundness of the chest, which can make the chest look more muscular, or in many cases just overall more proportional for your body. So pectoral implants can be done at the same time as a mastectomy or as top surgery. Or in some patients, pectoral implants are done, after they've had a mastectomy, at some point before in the past, but but they've still been working out, still not happy with the results, still feel their chest is a little too flat. Then pectoral implants can be helpful. Or in some cases, patients have had mastectomies, but too much tissue is taken out and can lead to making a chest look very concave and very indented. So the pectoral implants are going to be important for that type of reconstructive procedure. Typically, this aspect of the operation, is usually about an hour or so. I do measurements to see the size of your chest and what size of implants to use. Place those implants under the muscle and then close off the incision. I typically use the same incision that you've had if you've had a prior top surgery procedure, or if it's at the same time as your top surgery procedure. Obviously things will be open, so I can once again just place it in without having to use any additional incisions. Once again, using pectoral implants can be important for many individuals who want to create a more masculine or fuller muscular chest, despite, once again, having used hormones or exercising. So after the operation, all the surgical sites that have been addressed, so either tummy tuck or abdominoplasty or the liposuction or the pectoral implants, all of those areas will be covered in some type of compressive dressing, so an abdominal binder or ACE bandages. Once again, I would say that the number one procedure that patients do want for body masculinization is typically going to be liposuction from the hips and buttocks and from the abdomen. But as I said, there are a whole host of other procedures that you may want to pursue and which will individualize for you. After the operation, you'll be in the recovery room. Most patients stay there for an hour, maybe 2 hours, until the anesthesia wears off, and then you'll be able to leave. You do want to stay in the Bay Area for about another week afterwards, but rest, take it easy. I do prescribe a whole host of different medications to keep your pain under control. I like to use anti-inflammatory medications, and then you also have stronger opioid medications. Most patients will use for a couple days and then typically be able to wean off of it. Then most patients are able to start taking showers, usually a couple days after the operation, but I do take it on a case-by-case basis, depending on what we've done. When you do come back at the post-operative visit a week later, we remove the dressings, take a look at things, make sure there's no evidence of bleeding, infection, and then we provide further instructions, and then also talk with you about, further wound care and scar care. Scar care is going to be super important, so using a silicone cream or silicone tape, usually about 2 to 3 weeks after the operation, and we'll instruct you on how to do that. And the other thing is, for the first month, really taking it easy, no heavy lifting, no weightlifting for about a month. And then after about a month, you can start increasing your activity. If you're doing body contouring, liposuctioning, body masculinization at the same time as your top surgery, then the restrictions that you have for top surgery are going to be applicable to the body contouring. In terms of going back to work and school, for most patients, usually about 2 weeks, as long as it's not strenuous. If you do have a more strenuous job, such as construction or really heavy lifting types of occupations, then I would have you, wait up until about a month if you can, in order to move forward. And if there's forward with work to help minimize swelling and bleeding and to have a safe recovery. And if there's any paperwork that needs to be filled out, then we can certainly help you in that process to ensure that will be the case. I think what's important after the operation is to really give yourself time, even though, I've removed fat, if I've done, liposuctioning, or taking out skin and fat if I've done a tummy tuck, for example. You do want to give yourself time. It can take several months before you have, your final results. Initially, you're going to look swollen. Things might look lumpy. You might have some hard areas, but these will typically go away after about 6 months. But in many cases, it might be up until about a year. So you really do want to be patient, in terms of having your final results. We'll have follow-up visits. Once again, you'll have an initial follow-up visit about a week later. And then if you live in the area, we'll probably set up another follow-up a couple weeks after that. If you're from far away, we'll usually have a phone or video follow-up, a couple weeks after that. And we'll keep checking in throughout the course of the year. And then my team is always going to be available if there are any issues or concerns. As I said, you can start exercising usually about a month or so after the operation. So you do want to give yourself some time, and then wearing compression, some type of compression for about a month after the operation is going to be really important. So what can happen in terms of risks? So the operations are relatively safe, but with that being said, risks include bleeding. The transfusions are extremely rare and unusual. Infection tend to be pretty rare in this area. We do give you antibiotics beforehand to ward off antibiotics, and in some patients you may need antibiotics postoperatively, but pretty rare. Scarring, we talked about that, and certainly ways of helping to minimize that postoperatively. Damage to nearby organs, damage to your intestine or your abdominal organs from the liposuction, really, really, really rare. But that, is always a risk with any operation, just to let you know. There's always a risk of, needing a revision. So I'll do everything that I can to make sure you look good, but there's always unpredictability in terms of how you heal. So there can always be the potential that you might need a revision later down the line, but we won't know that until typically about a year or so afterwards. And so, in terms of, deciding whether or not we need to do that, we want to give yourself several months of healing before we bring on that discussion. You can also have what's called nerve pain or neuropraxia, neuropathy, where you get this burning type of pain. And this is where you have overactive, nerves. It's kind of like when you've fallen asleep on your arm and you wake up and it has that very numb, tingly feeling. That can sometimes happen in some surgical sites. Really can be very uncomfortable. In most cases, will go away on its own with compression, with massaging, with certain types of medications. But overall, it's going to be time that's going to get that under control. But if that is an issue, then that's certainly something that you can bring up to me and I can address. So kind of the take-home thing for body contouring, and particularly for body masculinization, is ensuring your safety first and foremost, is about meeting your goals and expectations. For many patients who do pursue body masculinization, it's about creating a more streamlined, square body. But once again, it's going to be variable from patient to patient. And so you need to tell me what your goals and wishes are, and I want you to be open about that so I can, find a way of meeting that. The other thing is that, it does take time for recovery, that you do want to give it time. It's not going to be instantaneous. It's going to take several months, and there's always the potential of needing revision. Most patients don't, but that can always be the case with body masculinization and liposuction in general. Thank you very much.